Okay, so to finish the physical exam for the breast and axilla, you would have the patient seated and they have them hang their arms loosely on their sides. And you would inspect both of their breasts and compare them for like size, symmetry, contour, see if they have any retractions or dimpling, assess for skin color and texture, any venous patterns that you can see, any lesions, or any supernumerary nipples that they may have. You also want to inspect both of the areola and the nipples and also compare them for their shape, symmetry, color, see if they're smooth, the size of each, if they're inverted, if they have eversion or retraction, any kind of abnormalities like that. You want to inspect the breast with the patient in different positions. First, with their arms extended above their head, then with their hands pressed on their hips or their hands pressed together in front of their chest. You also want to do it with them seated and leaning over, and then in the recumbent position. And that just helps you see any abnormalities that may show up in those different positions. So you want to palpate the breasts systematically in all four quadrants and the talus sphinx and over the areola for lumps or nodules. And if the breasts are large, you would perform the bimanual palpation. While you're palpating, you want to check for the lymph nodes in the apex, medial and lateral aspects, anterior and posterior walls of the axilla, and their supraclavicular area. You also want to palpate with the patient sitting and supine with one arm behind and a towel under their shoulder. And again, that's just different positions to check the lymph nodes in the area for different abnormalities. So for the female genitalia exam, you would have the patient in the lithotomy position. You want to inspect the pubic hair for characteristics and distribution, and inspect and palpate the labia for symmetry of color, if there's any discharge, inflammation, irritation, if the skin is excoriated, or if there's any kind of edema. You would also inspect the urethral meatus and the vaginal opening for any discharge, lesions, polyps, fistulas, any kind of abnormalities like that that could cause them problems. You want to milk the Skene glands and palpate the Bartholin glands and check for discharge and any kind of like foul odors that may occur with that. Inspect and palpate the perineum, for smoothness, tenderness, see if there's any inflammation, if you notice any fistulas or lesions, or any abnormal skin growths. You also want to inspect for any bulging and urinary incontinence as you have the patient bear down. You want to inspect the perineal area and the anus for skin characteristics, any abnormalities that may be present, like lesions, fissures, any excoriated skin, or any inflammation. For the internal genitalia speculum exam, you would select the proper size specula, insert it, and when you open it, you're inspecting the cervix. You want to check for color, position, size, any surface characteristics, discharge, size, and the shape of the os. That can also tell you like which way the uterus may be facing and any abnormalities that may be present there. At this time, you would collect any specimens for cultures or pap smears that you may need. And you would also inspect the vaginal walls for color, any surface characteristics, and any secretions that you may notice. So for a bimanual exam, you would palpate the vaginal walls for smoothness, tenderness, and any lesions such as cysts, nodules, or masses. Palpate the cervix to check for the size, the shape, the length, the position that it's in, and its mobility. You would palpate the uterus for location, position, size, and shape, contour, mobility, and tenderness, and note any abnormalities or any characteristics that you find. You also want to palpate the ovaries for size, shape, consistency, and tenderness. And you also would palpate the adnexal areas for masses and tenderness. So for a rectovaginal exam, you would assess the sphincter tone to make sure it was adequate. Palpate the rectovaginal septum for thickness, tone, or nodules. Also palpate the posterior aspect of the uterus. Palpate the anterior and posterior rectal wall for any masses, polyps, nodules, any other irregularities, any tenderness, anything that you would know, or any discomfort that the patient may have. You would also want to check any stool that you find for guaiac. So for a male genitalia, you would again check the pubic hair for characteristics and distribution. If they're uncircumcised, you want to make sure that you retract the foreskin so you can inspect the glands of the penis for color, smegma, external meatus of the urethra, and any discharge. Palpate the penis for tenderness or induration. Inspect the scrotum and ventral surface of the penis for color, texture, asymmetry, unusual thickening, and presence of any hernias. You can also transilluminate any masses in the scrotum so that you can see differences there. Palpate the inguinal canal for direct or indirect hernia. And I know with that assessment, you can also have them cough, which can bring about a hernia. Palpate the testes, epididymides, and vasa differentia for consistency, size, tenderness, bleeding, lumpiness, or nodules. And last but not least, for the anus, rectum, and prostate exams, you would inspect the sacrococcygeal and perianal area for any skin characteristics, any lesions, any pilonidal dumpling, or tufts of hair that they may have, any inflammation or skin excoriation. You would inspect the anus for any skin characteristics present, lesions, fissures, if they have hemorrhoids, or things like polyps, fistulas, or prolapse. You would also assess the sphincter tone and palpate the muscular ring for smoothness and evenness. You would palpate the lateral, posterior, and anterior walls for any nodules, masses, polyps, tenderness, and any other irregularities that may be present. In males, you palpate the posterior surface of the prostate gland through the anterior rectal wall for size, contour, consistency, and mobility. And then in females, you palpate the cervix and the uterus through the anterior rectal wall for size, shape, position, smoothness, and mobility. You also want to have the patient bear down and palpate deeper for any tenderness or nodules that may be present further in. And again, assess the stool for guaiac. Thank you.